Make sure that the feet are covered and warm, and tuck the towel into your client's underwear and bring it right down to the coccyx. Don't lose contact with your client, so stretch over, bring the oil to your hand and apply. Just going to lower it again. My client likes a firm pressure, so I've lowered the couch so that I can use my body weight. Make sure you have enough oil over the deltoid areas and all the way down the sides of the back. Not too much so that you're slipping and sliding. Okay, once you're ready, thumbs at the base of the coccyx, effleurage using your thumbs by the Erector spinae, all the way up into the occipitals, press into the occipitals, lift the trapezius, and it should be down the sides. So, thumbs up, press into the occipitals, lift the trapezius, and down the sides. Again, 3 to 6 of each movement. Lift and to the sides. Follow this up by lateral effleurages, coming up the sides, around the deltoids, into the trapezius, lift the trapezius, and back down the center. Most of the pressure coming up towards the heart. Next movement, thumb kneading around the gluteal areas. Make sure your client is aware that you'll be working on this area and that they're happy for you to work. And you'll work over the gluteals, both thumbs simultaneously, so you can use your body weight. If your client needs more pressure, I suggest you do one side and reinforce it with one hand. Michelle, did you want more pressure?
No.
Less pressure?
Yeah, just a bit.
Okay. Do remember to give your client the option of less or more pressure. This is an area that normally suffers quite a bit with tension, so spend a little bit of time working around. So you work the whole of the upper gluteal areas and in towards the sacral. Right round the pelvis. If this area is a little bit painful, I suggest you just use your palms to give it a bit of an effleurage before you move to the next technique. Next technique continues to be a thumb pushing up the Erector spinae. It's an interrupted thumb kneading. Relaxing the muscles around the spine. If you have a large client, it doesn't necessarily mean that the pressure needs to be more. They may in fact feel more sensitive, and therefore the pressure may need to be less. So don't automatically think if you have a large client they want more, and if you have a smaller one they want less. It doesn't work that way. It purely is client preference. So thumb pushing up the erector spinae. Again, I suggest 2 to 3 times minimum for each technique. And all the way up into the occipitals. The next technique is working again on the spine and on the erector spinae. Thumbs either side, pressing and pushing underneath the vertebrae. This relaxes the vertebrae. Is this comfortable? And you will work up and down each side. Always tell your clients if something feels uncomfortable to let you know, or equally, if something feels really nice to let you know again so that you can repeat that movement. You can see where there's an area that's sensitive, so you can just knead that area, soothe it before continuing. My client has a spine that's actually quite easy to locate. Sometimes it can be more difficult, so you do have to apply a little bit more pressure in order to locate the areas. Once you get to the cervical part, you continue, but it becomes a little bit lighter. And again, all the way up to the occipitals, right to the top of the cervical spine, and then back down. The whole of the back massage should take anything between 20 to 25 minutes within your routine. But if a client books in for just a neck, back and shoulders, you could ensure that you could do a half an hour to 45-minute treatment by doing more of these techniques, and also I will show you some additional ones at another time. So once you've gone up and down the spine, you'll gently effleurage up whilst you walk around the couch, so that to link your techniques together, and you do exactly the same technique on the side, your client's right side. It doesn't really matter if you work up and down or down and up, as long as you work both directions. The best position to work the back is with your client's hands on their side. You can access the muscles a lot better because they're more relaxed. Work right down to the fused area of the spine and then back up. You may find that by this stage your thumbs may get a little bit tired, and this is where the next technique comes in handy, because you'll be using some entire hand effleurage prayer techniques. Again, a little bit more gentle over the cervical area of the spine. And then you walk back to your original side to do some prayer effleurages. These prayer effleurages are lateral, starting at the side of the spine, pressure down and across. Make sure you go all the way out to the deltoids, right up to the neck, and then work your way down. Next part of the routine is dividing the back into half. You're going to be working first the side furthest away from you, and then the side closer towards you. So supporting and stretching with one hand, I'm going to work with my right hand on my client's right side, thumb kneading all the way up from gluteals up to the trapezius. Make sure you stretch, especially where you have a client with a more mature skin. You'll need to stretch a lot more. Spend as long as you need to on each technique. I'm just simply demonstrating the technique, but you can spend longer or shorter period of time. Work around the scapula. You can change hands. You can work slow, deep techniques under the scapula. If you need to get even deeper, you can use the chicken wing method, whereas you can bring your client's arm behind their back, release it, and then you can really access the scapula quite deeply. I suggest the smaller the techniques, the slower they are, the deeper they will be. So you could work right round for as long as you need. Don't worry too much about the upper trapezius. You will go back onto that. Then you can just relax the client's arm back to the side and effleurage the side that you have worked on. Then you will thumb knead the side closer towards you, this time stretching with my right hand and working with my left. So on the left hand side of the client you work with your left hand, and on the right side you work with your right hand. That pressure still okay, or would you like more or less? Also, if you have a client that has quite a large chest, so that quite a bit of breast tissue, you just be very careful, obviously, with the fingers and working around the side of the body. Normally I would spend a little bit longer on this area because I can feel quite a bit of muscle tension. And again, if I need to, I can bring my client's arm up, and then that reveals the scapula. There are various other techniques we can use here, which I will show you later on. For the time being, thumb knead, and you can finger knead around this entire area. You can then straighten the arm, and again effleurage the side that you have worked on. What you then need to do is work your way up to the upper trapezius. I suggest you do that with knuckling movements. This can work simultaneously the lower back whilst working your way up to the top. This is really good technique if your client has problems with the lumbar kind of area of the back, with a quadratum lumborum. As you use your body weight to push up. Avoid pressure directly over the spine, but you can put pressure by the erector spinae to the side of the spine. Then you're going to work to the upper trapezius. You can use some knuckling. You can use thumb kneading techniques. And you can also use finger kneading techniques to access the sides of the neck by the base of the skull and the base of the ears. If you can't get into the position that you want to, if your hands can't get into the correct position, you can come to the top of the couch to work the upper neck. Don't worry about using alternating techniques. You can go back to knuckling and back to effleuraging and thumb kneading. Remember, the slower the technique, the deeper it will reach the muscle. Spend as long as you need to, and then effleurage to soothe. Depending on my consultation, I would have concentrated on some specific area. So 2 to 3 of my effleurages to the erector spinae, 2 to 3 effleurages of the lateral part of the back, after which I'm going to link it onto my vertical effleurages, which are the prayer techniques, stretching the back. starting from the middle, from the midline, working outwards. Right to the side. And then work your way back to the middle. And then to the side furthest away. Link the movements together. Use your body weight if you need to put more pressure. Then work your way back to the center. Linking all the movements together. And then to complete the back, come to the top of the couch to finish off with some upside down effleurages. These are becoming quite gentle. Flat hands down the spine, across the gluteals and up the sides. And then reverse. So you will go down the sides, lift the gluteals and up the erector spinae. Two to three of these are ample. And there are two different ways that you could finish the back of the body. First one being alternate stroking of the back. Some clients may enjoy this, others may find it irritating. So that's just using your fingers nice and slow. Stroking. Or the second one is my favourite, but you do need to have ample time available, and that's the single-handed alternate effleurage over the spine. This is very, very slow, and it helps you to gauge the client's breathing, relaxes the client, and hopefully gives you a chance to get your breath back, ready to start the front of the body. You have to have patience for this movement, and you have to have time. The back of the body should not take you any longer than 40 minutes. 15 minutes for the back of the legs, maximum of 25 minutes for the back. And on completion, you would gently come off. I suggest you come over. Cover the client. Make sure that you untuck the larger towel from the underwear so that you can comfortably turn your client over, ready for the front of the body.